Great, thank you. And in our order for the panel, we next have Deborah Doctor from Disability Rights, and then we'll go to SEIU representatives. Thank you.
Thank you, Senator Monning. Deborah Doctor from Disability Rights California. I've been pretty much living this issue since June of 2014, I guess it would be, and I learned things on this panel. As Kathy said, it's news to me that a provider can correct a violation in the second half of the month. I'm thinking if the violation is that you exceeded the work week limit, that you could cure this by working fewer hours. I'm interested to hear about this because it's literally news to me. I want to talk a little bit about how things have changed for consumers and providers, but I want to start off by saying that there is absolutely no doubt, and we have not questioned, that the department has done a huge amount of work in a very short amount of time, and we really appreciate that. I also want to say I appreciate that there are exemptions and exceptions in place, and that won't be the end of my conversation about them, but I absolutely do want to have that on the record. Things, for the vast majority of IHSS consumers, the overtime either doesn't affect them or it's a good thing. So we're talking about the issues that we're bringing up are on behalf of a very small number of people, issues that I'm bringing up. And when you think about the asks that we're making and the minimum fiscal impact of them, I want to remind the senators that the current budget anticipated overtime starting last August 1st. It was in for the whole year, and we didn't start paying overtime till February 1st. So from my point of view, that means that there was a lot of money saved, and a little bit of it could be spent now. A little bit of what was saved by overtime not starting in making sure that, as Pete said, that nobody gets harmed, no provider gets dismissed, and most importantly, no consumer's care gets disrupted because of misunderstandings or misinformation about these new rules. As Kathy alluded to, consumers now have to translate decimals into minutes, which I was not able to do to try to explain this to somebody. The fact that the violations can be rescinded is not a comfort for the people I'm hearing from. They want to do things right. They don't want to run the risk. They want to obey the rules. They don't want to get a violation. It's not a comfort, because I've tried. When I say to them, oh, don't worry about it, it's only your first violation and it could get rescinded. That's not what these families and providers, they want to do the right thing. I want to talk about the exemption and the exception. And the first one, which is referred to as the family exemption, I refer to as the parental exemption, because the only people who are covered by it are providers who are parents or acting in the role of parents, grandparents, foster parents, and so on. It does not cover the people who have testified at other hearings, say a provider taking care of her husband and her child, or her father and her child, or somebody taking care of his two parents. They are not covered by that. So you'd think, well, they could maybe get covered by exception 2, which is true in theory, but the department has decided not to tell people about this exception. So I don't think you really get credit for providing a benefit or an exception that's a secret. The reliance has been on that the county social workers, some of whom have caseloads of 300, are going, in the midst of doing everything else that they do, they're going to know their clients so well that they could identify those people and let those people know about the exceptions, and that the people would then, if they're entitled to them, get the exceptions. Only this starts on Sunday. So the reason that there's only been 1 or 2 approved is because the only people who know about them are the people who have testified or have contacted me or union staff. That's why there's so few, because other people don't know about them. And that means that they are not going to show up if you rely on people who get violations, because these are folks who are going to do one of a few things. They're going to stop providing the services that they would be able to if they knew about and got an exception, or they're going to provide them and not bill for them, even though they would be able to if they got an exception, or they will put them on their timesheets and incur a violation because they didn't know they could get an exception. And I don't know how long it will take for people to ever find out about these, but if they follow that third path, they will get enough violations before they know about this to actually be in danger of being suspended from the program. So one of my primary asks is for this legislature to direct the department to tell people, I think it's a little, to say that, you've complied with the Department of Justice rules because you've got an individual exception only counts if people know about it and can get it. And it's also, so there's process issues and there's substance issues. And on this exception, for the most part, the grounds for the exception, and again, I want to praise the department for recognizing that there are people whose physical or mental health would be harmed if they were forced to get another provider, but that only covers people who live in the same household as the provider, as if residence defines whether or not you would be harmed here. It doesn't make sense to me in any kind of, me being a recovering social worker and all, that you would recognize that there could be harm, but say you're only protected if you live in the same household as your provider. I don't get the connection. Let me see, there was one. Pete was right when he started off by saying that for the most part, the new rules don't affect consumers' abilities on many fronts. But it is correct to say the new rules absolutely do restrict the ability of consumers to hire and fire, because they are being made to hire providers that they don't want, because they cannot continue to keep the providers they do want if the provider would go over the caps and not be eligible for an exception. And the other issue is this issue of wait time. And it's great that there is now the federal direction to pay a provider when the provider has to go with somebody to the doctor's office, and they will get paid for the wait time, except that doesn't do you any good if you're already at or near the maximum hours, because this is coming out of people's service budget hours. So if you're somebody who has high needs and you have a bunch of doctor's appointments, this doesn't do you or your provider any good. It should be handled the same way as travel time outside the service budget. Otherwise, it's of no benefit to arguably the people who need this most. The calls and emails that I've been receiving, which are mostly from parents, are bringing up issues that I'm not laying at the feet of anybody, but they illustrate to me that all the accurate information has not filtered down in the many levels that it needs to. I've gotten a couple of frantic emails from parents saying, I hired another provider because I didn't know there was going to be a family exception, and now that there is one, but technically I'm not going to qualify because I already hired the second provider. That kind of thing, where I'm hoping the department will look at those in the spirit of what the exemptions were intended to do and intended to be, and not penalize people who thought they were doing the right thing by cutting down, adding other providers and cutting down their hours. So for all of these reasons, we're asking for something I do think is reasonable and modest, and I can't really understand why, given the fact that all the necessary documents aren't out at the highest level, meaning that the information is not available to the actual people affected, why we cannot, and I'm saying on behalf of all these groups, that we should extend the grace period so that the department and everybody can do what they say they want to, which is to enact these rules fairly and with the least amount of harm to the consumers. Thank you.
Thank you very much. We're going to move to our SEIU witnesses. I want to thank you for your patience. Just a time check for, I know many people are waiting to offer their testimony. The chair did request that we get through item 10, and then we'll open up to public testimony on all of those issues. So we're mindful of your patience and time, but we do want to follow this schedule. I'd ask our SEIU witnesses, and then we'll ask the department for some response to what you've heard before moving on in our agenda. Thank you. Welcome.
Tiffany Whiten with SEIU California. In particular, on behalf of our 310,000 long-term care members, I would like to echo the comments made by my colleague, and I would defer my time to our member here that can tell you far too well the impact that this would have on her as a provider. Thank you.
Great. Thank you and welcome. Thank you.
Good afternoon, Mr. Chair and members of the commitment. My name is Angelica Salinas. I'm SEIU Local 2015 member from San Jose, and I have been an HSS home care provider since 2014. I am a mother of 7 children and 14 grandchildren. In 1998, I went to school and became a medical assistant and worked in a hospital until 2006. In 2014, I became a HSS provider for my mother, who had Alzheimer's and dementia, as well as high blood pressure. I took care of my mother until she passed away in the latest 2014. And since then, I have been HSS provider for various consumer caregiver worker. Is hard, life-saving, and extremely valued to our society. Historically, it's been overlooked and undervalued to the point of the exclusion of the basic labor protection. California is taking huge steps forward by implementing the FLSA, but caregivers and clients both need FLSA to be implemented fairly, quality of care, and fair treatment to the caregivers. The caregiver must and can both be accomplished. I'm here today to speak on behalf of my brothers and sisters who are also HSS provider. The implementation of the overtime has been very confusing to many providers. They fear getting violation and possible termination from the program. The fix the HSS advocate are proposing will help to simplify the FLSA implementation as provided. We want to be able to take care of our consumer without fear and being determined. Thank you, and I urge you to support the proposal put forever. I did this for my mother, in memory of my mother, to come here and talk about.
Thank you, Ms. Salinas. We appreciate your testimony today, and more importantly, we appreciate your service, not only to your mother, but your other patients that you've supported through your career, and your support for the state of California. We appreciate it.
Thank you. And also for my, the other caregivers, they speak Spanish like me, and they don't speak no English. When I call them for meetings, they say, oh, I don't know how to fill it out, the time card, so I'm not gonna put the extra hours I did because they're not gonna pay me. They're gonna give me evaluation. That's what they're confusing.
Right. Well, I appreciate your offering that addition as well, and I think part of what we're trying to get to the bottom here is how we both spread the communication and make sure the communication is done in language-appropriate communities, recognizing that many of the providers are not English-speaking. So, again, your presence and testimony today is greatly appreciated, and I think if that concludes our SEIU testimony, I'd like to go back to the department for any immediate response. There were some very specific questions and recommendations. If you could respond to some of those, I'd appreciate it.
Pete Charavanka again with the department, and thanks for the opportunity. I appreciate the candor that folks and the spirit in which they brought the comments forward. I think everybody is in agreement that what we're doing here is complicated. It's not going to be perfect. It is going to be confusing. I think everybody is geared toward protecting the health and safety of recipients, and appreciate that everybody is solution-oriented in trying to find the appropriate remedy for the individual circumstance. There probably is no future point in the program where every issue that has been raised has been resolved to everybody's satisfaction in order that we can move forward. The best way to identify issues is to actively address them. I think it's important to remember the context of what we're dealing with in terms of the multi-month effort to do work week agreements to ensure coverage, in terms of the work that we have done to make information available, the work that our counties have been asked to do with providers, the work that labor organizations have been asking to partner with us on that we just enabled as of yesterday. There's a lot to do here. It's complicated. As situations arise, we will work on it. I really don't know what I can say in significantly more detail to you than that.
Appreciate that. Let me maybe just focus a couple of the questions that I heard. So based on what you've heard today and through your own testimony, the challenge of getting the information out, the training to county workers, the communication to providers, as well as recipients. Do you feel that the department feel that providers and recipients are prepared for the department's timetable of May 1st implementation?
So while the May period begins the formal process, I think that the time between now and the end of the first week in June is a lot of time to do what we need to do in this program to make sure that people understand the rules. I think there is work to do on the training. Our director has offered to counties to waive other workload obligations like timely reassessments for a defined period of time for them to redirect staff to accomplish this. When we look at the number of violations that are not violations, when we look at the number of errors that we appear to be tracking at this point, we believe that that number will continue to go down. And we believe that when you divide that by counties, with the exception of the few large counties that we have, these numbers are not huge that we're talking about as potentially eligible for exemption criteria. We do expect, and we have every reason to believe that counties are capable of fulfilling their obligations under the program. We are fully committed to assisting them to do that, to continue to provide the instructions, to answer the questions that arise as a result of ACLs, even in their final form. Because there are so many individual circumstances in the program, questions inevitably arise, and we've made ourselves available and will continue to do so to answer those questions. We have been working with representatives of counties to develop flowcharts for this process so it can be more easily understood. We have ourselves dedicated people to resolve these issues. We have dedicated line for county staff to come to us. You know, in terms of clarity of instruction, which was one of the things that was raised, you know, we can work on that, and it will always be a work in progress as new situations come up. We think, given the numbers in most counties, you don't have to train your entire workforce to be prepared to this.
Thank you.
We think you can train a dedicated number of folks in the short term, and there's a short term and a long term solution for this. We continue to work to implement the system functions that Ms. Senderling indicated did not exist at this point. Our staff continues to do the data entry and review of all of the exemption requests that come to us. It's a shared effort to get to where we are, and we think we are confident that we can handle what comes.
Thank you. I'm curious what you think. One of the recommendations or proposals was to delay implementation of violations while this continued education and implementation moves forward until, I think the recommendation was September, that you wouldn't postpone implementation. But because of the fear among recipients, the fear among providers of being tripped up, of doing something wrong, of potentially jeopardizing either their continuity of care or their ability to continue continuity as a provider. How do you respond to that recommendation?
Sure. The administration feels pretty strongly that the grace period shouldn't be extended, if you will. We think with violations 1 and 2 being a continued opportunity for a dialogue before there's an actual consequence to a provider, that we're getting most of the way to September there, all on its own in the current implementation path. Errors that are identified, and we're making that data available now weekly to counties and labor organizations on a go-forward basis, will continue to result in errors being corrected. Folks have the ability to override any potential violations and make other appropriate arrangements. Correctable errors always have been able to be fixed and will continue to be able to be fixed here. To a certain extent, receiving that notice, acknowledge that it may be scary, is one way of sunshining these issues, and we are committed to resolving them. And as those conversations occur and during any dispute process for them, there is no imposition of the consequence of that while a dispute is pending. We, again, don't think there are big numbers in most counties for this.
Okay, thank you. I am curious, what has been your process for involving stakeholders to date, and how will that process roll out during this implementation period?
Absolutely. So we have global conversations. We met with labor organizations yesterday. We had meetings, not recently, but with Deborah Doctor and her organization over time, and of course with our county partners at the County Welfare Directors Association. As I described in my earlier testimony, every single all-county letter and information notice that we put out goes through a robust stakeholder process. We don't draft those by ourselves in our own buildings. We involve people in the drafting of those, and then they go out for a formal up to 2-week comment period. And as I said, some are shorter than that. But we continue to collect comment and have issues raised to us. On the side, we're working with counties on job training aids. We committed to labor organizations yesterday when we met that we would involve them as well to make sure that those job aids, like the violations flow charts that were mentioned, are available to people so they have the tools that they need to do it. Our director has committed that counties can redirect staff as needed to address this workload and that they will be relieved from other obligations at their request of us to meet the needs of this policy. We think overall FLSA is a really good policy for this program, but the implementation is incredibly complex, and we recognize that.
Thank you. Did you have something you wanted to add?
Go ahead.
Just to answer a comment that was raised on the ACLs, the 2 drafts, we anticipate having those out within the next week and a half. So we will have everything out, final forms, everything will be completed within the next week and a half.
And would it be fair to say that as this is being implemented, what I've heard you say for both providers and recipients, that there will be the opportunity to engage with county case representatives and the state if necessary to resolve questions, problems that's built into the system?
I think as she testified, the issues that you raised are legitimate, and it's our goal to ensure that the needs of the recipients are met. We don't intend this to be a scary process. We intend it to be a trigger for a conversation to resolve the individual issues.
Right. Well, I appreciate that, and I just think it's important for the community to hear that and to bold that and underscore it as we move forward, that if anyone feels that there's a gotcha mentality or a prosecutorial mentality, that's not what we're hearing is the state's intention, and we'll rely on everybody to work together to make sure that this is designed to protect the interests of recipients as we move forward.
And I appreciate that comment. This is not a program integrity measure. This is an opportunity to ensure that people know the rules of the program and that we have the opportunity to engage with them in finding solutions to the individual issues. This is not a gotcha, as you've stated.
Okay. Okay, thank you. I want to thank the witnesses on this panel. Thank you so much, and special thanks again to Ms. Salinas for your work and service. We appreciate your being here today. Thank you. Just again, kind of an agenda check, we're going to move to issues 8 and 9 for presentation. Trailer bail language in issue 8, the budget change proposal in issue 9. Those will be presentations by the department. And then when we move to issue 10, proposals for investment, I'm going to ask that when we get to that, people try to be succinct, since many of these issues have been raised already in our conversation, and would like to expedite getting to the public comment. So with that, we'll move to issue 8. It is page 24 on the agenda. Thank you.
Thanks very much. I'll take issue 8, and Eileen Carroll will take issue 9, and we'll be fairly brief about it. With the implementation of the Coordinated Care Initiative, there was created a county maintenance of effort obligation in terms of funding for this program, and as a result of that maintenance, there was a built-in inflation factor to it, as well as what I mentioned earlier around the minimum wage question that was asked. Counties also have their maintenance of effort adjusted for the impact of any locally negotiated changes in wages and benefits. What was not considered in the implementing MOE statute were the impacts of county decisions to choose contract mode, where they contract with a firm who then provides the providers to operate the program. We put forward trailer bill language in January that would allow the MOE to be adjusted for the impact of decisions to go to contract mode, which is generally a higher cost option for the provision of services. And it was brought to our attention by County Welfare Directors Association that there may be some concerns with that, and county welfare directors have been engaged with our Department of Finance colleagues primarily in seeing if there's a way to resolve the technical differences here. We hope to have an update on that language at the May revision, but those discussions are continuing at this time. But it was simply to allow the MOE to be adjusted for contract mode decisions, and that was what we would call an oversight and of omission when the original MOE statute was created. So we view it as a cleanup item, but it's also important to get right. And it's in the trailer bill process because it has fiscal implications for the state general fund contribution to the program as well as county contribution.
Thank you, and you did reference some of the concerns of the advocates. They will have an opportunity in the public comment if they want to add further to that. Let me see if LAO has any comment on this item.
Thank you, Senator. We agree with this trailer bill language proposal in concept. However, because of the concerns that have been raised in the ongoing discussions, we concur with the staff recommendation to hold it open at this time.
Thank you very much. And Department of Finance?
Yang Lee, Department of Finance. So Mr. Trevang is correct. We are engaging with the counties at the moment, and hopefully we will resolve this issue.
Thank you. So with that, we will move to issue 9 on the budget change proposal. And again, I'll remind members of the public, advocates, an opportunity to comment on any of these issues we're going over right now. Thanks.
So issue 9 is the universal assessment tool that I mentioned earlier when we were going through the PowerPoint overview. It's part of the CCI initiative that's moving forward. And the goal of this is to create a consistent and effective assessment tool for home and community-based programs working with managed healthcare organizations. This proposal is asking for 2 limited-term positions so that we can align that work that we're developing in UAT with the goal to automate it and then to enter it into the CMIP system so that it's an automated assessment tool. The goal is to simplify and streamline the design and its development, and the staff are designed to help make that occur so we can reduce the cost to the automation once we do move towards CMIP's implementation.